Thank you. So those are, we're talking about the summer, we're talking about the holidays, but as you know, the world is getting quite crazy these days. And I think what's the most expected thing is the unexpected. This is the most certain thing. And we are all, I think you will agree with me, privileged to be able to cope with those crises with a good health system, accessibility to community support. And we in JDC GRID try to bring this goodness to poor communities around the world. We are doing it is inspired by Jewish values. We as we go, we try to strengthen Jewish communities and, of course, our beloved Israel. You will excuse me for 1 second. I didn't put my timer on, and because I love my work, I tend to talk too much. So I will, and I don't want here. I will time myself now, and I can start again. So thank you again. And I will take you to a journey around the world to see. Today we will focus how do we create sustainability? How do we create long-term impact when we start using our disaster fund, working around the world, doing good, but what does it say? How can we sustain this work? How can we maintain it and make the most out of it? So we will hear from partners around the world and focus on this afternoon. Yeah, please, next slide. So this is a picture that was sent to us today from Chen. Chen is part of our disaster team. She is now in Bulgaria, and she's hugging Dr. Svetlana. Dr. Svetlana is a Ukrainian refugee that we've been able to hire in Bulgaria. We've established a clinic using telemedicine, supporting kids, and she is able to give them support in Ukraine and also in Russian. And so on one hand, it's work for her as a refugee, and on the other hand is, of course, helping kids, helping refugees. We're partnering with the Red Cross, and we're able to reach hundreds and thousands of kids and adults every day. So this is just right from the field, and I was very excited to get this picture, and I said I will use it today. So Chen, if you can hear us, take care and give our best to Svetlana, and please thank her on our behalf. The other thing we do in Ukraine, we've established a clinic with JDC Natan near the border in Ukraine. We've already supported more than 20,000 people. I don't know if to be happy about this number because we're reaching so many people, but the truth is that it's so sad that so many people need our assistance in these challenging days. So we're doing health clinics, using telemedicine, sending assistive devices. We've sent more than 500 wheelchairs and crutches that are already in Ukraine, in hospitals, serving wounded soldiers. We're also working with our amazing FSU team colleagues. We're working with them in Europe, colleagues, also amazing, hand in hand, and we're now looking at bringing, and Chen and also Miki will be in Ukraine next week with the FSU team, looking at bringing staff from hospitals in Ukraine to be trained how to take care of wounded soldiers. Unfortunately, in Israel, we have a lot of experience in this area, so we can give them support and capacity. So this is the work in Ukraine that we take a lot of pride in these days. Please continue. We will visit India today. We have Dr. Ravi Kenan from the hospital in Koshal, who are unfortunately suffering from severe flooding these days, and JDC was able to support. This is the hospital where we established our telemedicine units, supporting ICU beds, getting support from Bangalore, 5 hours flight away, 2,000 miles. And today we will will hear from Ravi, from Dr. Kenan, how do they use the capacity we've been able to give them through the crisis on for the ongoing and building capacity also in cancer and other diseases beyond the COVID. Please, Yael, continue. Well, I don't have time. Please go on. Ghana. Thank you to the Ruderman Family Foundation. We've partnered with them, and we're grateful for this. We're going to launch bringing Israeli medical technology and building medical capacity. We will start in Ghana, continue in Morocco, in the third country. We're now in the midst of a very deep planning process where we're looking and examining the health system, the vast needs, the best potential partners, and already thinking about sustainability. When we look at what kind of partners we will choose and what kind of health challenge we will focus on, we think of how can it be sustained for the long run. So stay tuned, and I hope in the next forum we will have pictures and stories to tell from the field. Please continue, Yael. We will also be focusing on our amazing spine surgery program. We are following the example of Dr. Wickhard's vision. We have managed to create more. I used to say 1,000, but now I realize that it's over 2,000 life-saving surgeries. Most of the surgeries are done in Ghana. But today, together with the leadership of Dr. Wickhard, with the leadership of Dr. Abraham Tadele, Dr. Eskinder, and Dr. Malek from our own team, JDC team, we are building the capacity of Ethiopian doctors to do and create those surgeries in Ethiopia. Just that you know, a surgery that we send to a kid to Ghana costs between $7,000 to $20,000. Once we'll be able to do it in Ethiopia, it will cost us around $2,000, which you can understand we'll be able to reach many, many, many more kids and get the ownership of the Ethiopian government on this program. Please continue, Yael. I'm very proud of this. This is pictures I took 3 months ago when I was in Ethiopia. This is a torf field. Next to it, the neighbor, they grow the same crops. And when you see those fields, you can understand why a torf farmer earns $270 for a season, where his neighbor earns $46. So you'll hear more about it from Fegegta. How do we sustain this work with the government of Ethiopia and on. Please continue, Yael. Pictures from our Imagine More Women Economic Empowerment in India. We're also active in Ethiopia. I will finish with the dessert, honey. I told it, Annie heard me, and Jonathan, they were here in Israel. We are now working with South African women to create honey. We trained them. We got Koshal certificate for this amazing work, and I really hope we can send honey boxes for this Rosh Hashanah or maybe the next one following our work. We have, yeah, please continue. This is a picture that was taken on Monday, on July 17th. There was a Mandela Day, and 150 Jewish volunteers joined our program through Mensch to learn about our work, to volunteer, and to be part of it. We understand and we learn from the Jewish community that they take a lot of pride that JDC is there. They're there to support their neighbors, and by that, they're also strengthening their own community. I will finish here because I want to leave time for for questions maybe and for our next speakers. And I want to thank you. This work would never have been done without your support. So we're grateful. Thank you. Please, questions. Yeah, do we have questions in the chat or no? Anyone has a question? No, I was very clear. I will take this as a compliment. or maybe not. Jay, I will hand it to you to facilitate our health sustainability panel, please.
Okay, thank you, Avital. If anyone has any questions, as she said, please put them in the chat. We'd like to start our conversation about our sustainability in Ethiopia. And the JDC has had a long collaboration with the government of Ethiopia to establish the first spine surgery center in the country. Today, we're fortunate to have Caleb Tadasi. I hope I pronounced your name correctly, but Caleb will talk to about his work as a patient of Dr. Rick Hodes and now with his work at the JDC. So Caleb, welcome.
Thank you, Jay. I'm very excited to be here. My name is Caleb Tadasi, and my journey began in 2010. I was a 9th grade student at a public school in Addis Ababa, Ethiopia. One day when I was walking to my school, a retired nurse in my neighborhood stopped me on the street and said I have a bad back and that I should go to the hospital. I didn't mind her at the moment, but that night I shared this with my parents. They took at my spine, they looked at it and then noticed that my spine was curved. Immediately they became very upset and started blaming themselves for this. My mother thought this caused because of a related falling down accident in my infanthood. And my father thought it was because I carry a lot of heavy school bags. That's the reason. The next day, they took me to the multiple hospitals to find a cure. None of them could help. Then I was referred to the University Hospital in Addis Ababa, Ethiopia. After many tests, they decided that there was no possible treatment for me in the country. They took my parents aside and told them that I would likely not live for a long time. It's devastating. I was 14 at that time, so the deformity started to get worse by the day and I lost all hope. Some months later, a radiologist from a Blackline hospital heard about my situation. He told my parents that there is a doctor who treats patients like me at Mother Teresa's clinic. We went there and the next day met Dr. Rick Hodes. He examined me and diagnosed me with congenital kyphoscoliosis. In April 2012, I was brought to Focus Hospital in Accra, Ghana by JDC, and a 7-hour spine surgery took place. After that, my life changed and completely I regained my hope. I really wanted to give back to JDC for saving my life, so I started volunteering at the clinic. Soon enough, I was hired to facilitate the spine program that JDC has, and now JDC changed my life twice. When I got sick with the liver issues, Ethiopian doctors missed it, and Dr. Rick saved my life once again. I'm now married to a beautiful wife, expecting to be a father in a few weeks, supporting my parents and sending my younger sister and only sibling to college. After acquiring my BA degree in business management, I'm still working for JDC as the marketing and communication officer in Ethiopia. I'm very happy in life, and I would like to take this opportunity to thank my God, Dr. Rick, JDC, and the kind donors who transformed my life. Thank you for hearing my story. Now I would like to share a video that I created just weeks ago. This video documents Dr. Rick and our JDC team arriving at Dilla University Hospital in southern Ethiopia to train 95 doctors on spine deformity identification. While he was there, he also screened over 100 patients and identified 65 patients with spine deformity. Here's the video.
Fire.
So thank you, Caleb. Your story is very inspiring, and I want to thank you for your work with the joint. As was mentioned, Dr. Rick Hodes is working with the government of Ethiopia to create the National Spine Center in Addis Ababa. Dr. Abraham Tedeli is a surgeon and a member of the JDC staff. He's done some of the first spine surgeries, and it's an honor to welcome him with us today. Thank you, Dr. Tedeli.
Okay. Thank you very much. It's an honor for me to be here and to share with you this life-changing work. I've been in the medical practice over 10 years now. I joined JDC a year ago. As you mentioned, together with Dr. Rick and JDC team, we have been working towards establishing a sustainable spine surgery center in Ethiopia. Just last week, Avital was here in Ethiopia. We met with some government officials in the Ministry of Health, and the Ethiopian government is very committed and looking forward to getting started. And we have been provided with a space at one of the top government university hospitals in the country. And we are now working on training staff members and also procuring some important equipment for the practice. With respect to some of the surgeries we have done, maybe we can share you an image. And as already mentioned, we have been operating some cases which are less difficult to be operated locally. And if I can share one case, there was a child who, the image you see is a child and a father. They came from Dabra Tabor, which is about 600 kilometers from Addis Ababa. And the child was sick. He was unable to walk because of the deformity on his neck. And he was developing weakness of the upper and lower limbs. He was not able to walk. So they took him to the local hospital. They told them they are not able to operate the child, and they referred them to our institution. And the father was a farmer. He was unable to afford equipment. So with the support from JDC, we were all able to get the equipment, and the child was operated. And after surgery, his breathing started to improve. His weakness started to improve. He became able to walk without support, and he's now back home. Hopefully, he'll start school next year. And so this is very life-saving support for patients with deformity, and this is important. This is why it's important to provide the people of Ethiopia with access to be operated in the country. And this is a life-changing opportunity. And thank you very much.
Thank you, Dr. Tedeli. It was an honor to hear from you. We're now going to move to our sustainability and disaster relief work. In the time of March to July 2021, India suffered one of the worst COVID outbreaks in the world. Deaths at that time surpassed over 450,000, with 4,500 people dying each day. India's healthcare system was overwhelmed at the time, and the JDC set up a telemedicine platform in rural ICU units to help doctors remedy this issue and to remotely monitor patients. Today, we're joined by Dr. Kannan from Assam, India. He runs a remote healthcare facility that the JDC assisted in establishing telemedicine. Welcome, Dr. Kannan. Please tell us some of the challenges you faced at the peak of the pandemic. And recently, there has been flooding in Assam. And if you could talk about what the JDC has done to assist Kachar Hospital.
Dr. Kannan, you're on mute. Come off mute.
Sorry. So thank you to JDC for proving to be such a big source of support for us. I work for a small rural hospital in the eastern end of India, in the southern part of the state of Assam, and our population is predominantly rural, and most of them don't even earn $750 a year. They have large families, and it's a regular problem. Now, just because we treat poor people doesn't mean we deliver poor quality care. Poor people also deserve the same quality of care that anybody else gets. And one of the areas that we had a lot of difficulty was in managing our ICU for critical care. And so we are a cancer hospital. We do major surgeries, abdominal surgeries, thoracic surgeries, microvascular work. And then if we are not able to take care of them, when patients develop complications following chemotherapy and radiation and they become sick, they need good quality critical care. So that is where JDC came in and supported us in setting up a tele-ICU, high definition cameras in 5 different areas. We have a 14-bed ICU, and there are cameras which look at every single patient and can read every single monitor. And the monitor gets the readings get transcribed into a paper document. There are a team of doctors, ICU nurses, nutritionists watching over these patients, sitting in a location in Bangalore, about 2,000 kilometers from where we are. Now, the system is so efficient, you won't believe it. There was a patient on whom we had done a major abdominal surgery. 3 or 4 days later, the patient started to having a cardiac arrhythmia, irregular heart rate, and the patient was going into arrest. The cloud physicians saw and alerted the ground staff. Before they could do anything, the patient had a cardiac arrest. The patient was revived. 5 minutes later, the patient had a second arrest. The patient was revived a second time, connected to a ventilator. 5 days later, on the ventilator, the patient had a third arrest. Patient was revived a third time, and then the patient went home. Last week, the patient came as follow-up in our OPD. This has happened time and again. During the rain, middle of the night, everywhere there's floods. Gentleman from about 500 kilometers from here arrives in Silchar in cardiac failure. He had a heart block and he needed a pacemaker, and the whole place was shut down. And so somehow he managed to come to our hospital. We are a cancer hospital and we don't routinely treat these things, but the man was sick. So we put him in. The cloud physicians helped us stabilize him, control the failure. The next day morning, when we saw him in the night, he came with a saturation of 60%. In the morning, he was sitting up, saturation over 90, comfortable at rest. He went, he had a pacemaker and has gone back home. So there is a lot of strength in working together, using technology wisely, and all this happened because JDC supported us. More recently with our floods, we've never seen floods of this kind. There was more than 6 feet of water in the road leading to the hospital. Some of our buildings were flooded and patients could neither come in nor go out. And we had to do several things, from setting up a clinic outside on a high-rise part of the land. So we were running our outpatient clinics outside. We were delivering some all palliative care and some easy chemotherapy outside. And we were only transferring patients who needed hospitalization into the hospital. We had to make our own drafts to do that. And JDC stepped in and came up with support for cooking gas and diesel and for other things in the hospital. More importantly, they are also okay with us using the balance of the money to go. Now the flood waters have receded. We have to go and get patients. Patients have lost a lot of their property and they are no situation to come to the hospital. And we have to go physically bring them back to the hospital, make sure their treatment goes uninterrupted. And all of this will not happen without support from different quarters. And thanks a million times to JDC for supporting us. Thank you very much.
Thank you, Dr. Kannan, for your work and for your partnership. Now I'd like to turn things over to Danielle, who's going to talk about TOV.
Jay, before just 1 second, I'm sorry. I wanted to make a to clarify. When I spoke, I said that the new health initiative will be in Ghana and in other countries. I gave Morocco only as an example. We haven't decided yet on the 2 other countries. So stay tuned, and it will come in the coming months. And I wanted to ask our colleagues, Yael or anyone, if we had questions to perhaps Dr. Thank you, Jay. Thanks a lot. And thank you, Dr. Abraham and Caleb and Mazal Tov for the new babies to be born. And of course, to Dr. Ravi. I wanted to ask if we had any questions, and if people want to ask, we still have a few minutes to address questions.
There was a question about the spine surgery center and how long we predict it will take to get to a point of sustainability, or for it to like actually take place. So maybe Avital, you could answer that, or Dr. Abraham.
I would give it to Dr. Abraham, and then we can.
Okay.
So it's not going to be like a one-time construction and one-time work, but it's going to be a process. So we'll start it with simpler cases, going up to more difficult cases. So probably it will take like maybe in 6 months to 1 year's time. That's like a short-term target we're planning for. Maybe Fagakta also can add some points.
Yes, we already have a location. Now we just need to purchase some materials that we need to start the surgery services and see patients on a regular basis. So we are on the process. Seeing patients will start immediately in the next 2 to 3 months, but actual surgeries will take up to 6 months.
So thank you, Fagakta. For me, it's a beautiful example that in 3 or 4 years, we can phase out and live a sustainable legacy that started with Dr. Rickard's vision, continued with our team, and with the partnership with the government of Ethiopia. I assume that it will take us at least a year until we have something on the ground, and we are starting to fundraise for the equipment and for and we are looking forward for the government of Ethiopia to approve the St. Paul Hospital that they recommended in our meeting, Dr. Tedele, last week. Thank you. Any more questions, Yael, that were?
There was a question, Dr. Kanan, a question about how often do you find yourself kind of, or does the Koshal Hospital find yourself dealing with flooding from monsoons? It sounds like it affects the hospital and the patients. How often do you have to deal with these types of challenges, the environmental challenges?
So floods happen every year, but some years they are worse than other years. This year was probably one of the worst in the last several decades. It was never this bad. The floods happen every year.
Yael, do you want to put the picture from my presentation showing the flooding there?
Yeah, 1 second. I'm gonna share the presentation so you can see it. Hold on.
Yeah, you can see on the right, this was taking, I think, a few weeks ago or even a few days ago, and we were shocked. This is the hospital that we put the telemedicine units, and we were happy that we could use our disaster fund to give immediate support to this hospital. Okay, if there are no other questions, we could go to the
no other questions here. If someone wants to come off mute and ask a question, you're welcome to, but for now, here are no other questions.
Okay. Danielle, please.
Okay, so to transition, I would like to introduce Fagekta, JDC's country director in Ethiopia. Hi, Fagekta. Thank you for joining us today. So before we talk about sustainability, I know Avidal showed us a really powerful photograph at the beginning of this meeting, but can you share a few updates about TOV and where the program stands after 5 years? And maybe, I think everyone on here knows about TOV, but maybe if you want to give like 2 sentences before that's.
There is time for that, so yeah.
Okay, thank you, Danielle. I'm very happy to be here to give you all an update about the TOV program. Just to give you like a brief overview, TOV is a program that addresses the 3 major challenges that small farmers face in Ethiopia. One is the access to finance to be able to purchase various agriculture inputs and technologies. The second one is the access to technology, because we have very limited agriculture technologies available here in Ethiopia. Most of them are imported and they can be quite expensive. So we're trying to create access to some of these technologies, sourcing them from Israel. We use most of the technologies that are sourced from Israel, like the drip irrigation, the seeds that our farmers use, the hybrid seeds are all sourced from Israel. And so that's one way of us creating access to technology for smallholder farmers in Ethiopia. The third tier of this program is access to market, as we're helping farmers increase their productivity and their produce. We also helping them in market linkages. We try to link them up with different institutional buyers like universities, colleges, prisons, hospitals. So there will be a continuous market and demand for TOV farmers. So that's TOV in a few minutes. Getting back to your question, Danielle, about sustainability. Yael will share a slide and I'll just give you an overview. So for a second year in a row, we are able to increase the number of farmers from 200 in 2021 to 700. That is until the end of this year. And also in 2022, the government of Ethiopia provided a loan of $60,000. That's a significant amount coming from the Ethiopian government for purchase of technologies, various technologies. So our farmers get access to some of the technologies that are needed to adopt the drip irrigation technology. So that's a support we're getting from the government side. And also the Israeli government will soon sign a new contract, a 5-year contract with JDC to continue the program in Ethiopia and also expand to other countries. So that's a general update of what's going on since the beginning of this year.
Okay, and you're talking about growing. What are the plans to grow this program? And I think, we should mention, I had a call with Gidon yesterday and we were talking about TOV and the progress. And like for all of us, COVID was a major interruption in our lives. And it's so remarkable that TOV has grown so significantly, and COVID didn't even make the top 5 challenges that I heard when we were talking about all the things that kind of got in the way of the progress over the last 5 years.
Yeah, we worked through TOV, through COVID, because it wasn't that serious in Ethiopia. So we didn't stop working. We continued implementing the program. We went virtual for some of the trainings that we provided to government development agents. The trainings, we kind of like were able to do that, but like the hands-on support, we also used Telegram, WhatsApp. Farmers would send us pictures of their field, and if there's any problem or disease, they need our guidance or support, they would send picture, and then we would call them and tell them what to do. So we kind of shifted our activities a little bit, but continued. We didn't stop. So that didn't come up as a major. That's why it didn't come up as a major challenge. We have other access to Forex, which is the biggest headache for us right now, to be able to purchase the technologies that we need.
I see a question in the chat here from Maxine, which is, what are the primary crops and how are they sold? Are they sold in local markets or elsewhere?
Okay, the primary crops are tomato, onion, pepper, cabbage. These are the 4 major crops that we are working on, but we're also trying carrot in different fields. We've tried beetroots. We've tried another, what we call like a kale, which is largely consumed in Ethiopia. So we're trying other vegetables as well. We haven't tried fruits yet, but the 4 are tomato, onion, pepper, and cabbage.
I see Daniela wrote garlic here too.
Yes, we tried garlic this season in our region. Yeah, it's awesome. It got really good results. We're happy about that.
I have to bring my mom in as a consultant. She has a prolific garlic situation happening here. Okay. Okay. What you mentioned that the Ethiopian government is making a $60,000 commitment, and that was, a significant number. Sometimes we lose sight of what numbers mean in different contexts, but can you elaborate on what role the government plays? What role does the Ethiopian government play in your work?
So the Ethiopian government is really promoting the TOF program. They are organizing various events and inviting JDC to present about the TOF program. They really like the model. And we also get to exhibit the technologies that we use. So we show the drip irrigation system. Just to give you a context, in Ethiopia, it's not common to use drip irrigation system. We either grow waiting for the rainy season once a year, or we use flooding, just flooding by creating small canals, like physically. So drip irrigation is a technology that's like pretty new even for government. Only in big commercial farms we use drip irrigation. So introducing it to smallholder farmers for a quarter of a hectare of land is really done by JDC for the first time. So it kind of stirred up a lot of conversation among governments. So they are organizing farmer days, open days. They will invite various farmers to see our technology, and they will encourage more farmers to join the program. They will put in financial resources. So this is some of the support we've been gaining. And to scale this program, we are also going to be partnering with different organizations who are implementing agriculture programs. We are encouraging them to also adopt our model of introducing drip irrigation technology while they are implementing various agriculture programs. So that is happening in collaboration with other NGOs as well.
Amazing, thank you. Let's see. Does anyone else have?
There was another part to the question about the vegetables. Where are the crops sold in local markets? And we have an answer here, but Fagekta, could you please maybe share a little bit more where it's sold?
Okay, so it's sold in local market. We haven't gotten into export yet because there's still a huge demand in the local market. We can't even meet it. There's a lot of demand. We are a population of 115 million, there's still a lot of demand. So we're selling it to the local market. We have a contract with one of the biggest vegetable retail shops called Fresh Corner, and they take the produce of our farmers because they came visited, so that we are supporting these farmers. We're very careful with the way we meet the quality of the vegetables. So they were very happy. So on a constant basis, they buy from our farmers at a much reasonable price. Yeah.
Okay, I have one last question, which is, about the growth of Tove. So, we're 5 years in, you have 700 farmers, dramatic pictures, farmers who have 5 times the income. It's incredible. Where do you see this, or where would you like to see this go in the next 5 years?
So in the next 5 years, ideally, we'd like to see thousands of farmers using the technology. We have a target of 3,000, and hopefully we'll get there. But even more than that, we want to do that, and we will do it only like in partnership with the Ethiopian government and working with other NGOs to be able to work with them in their agriculture programs to promote the various technologies that we use, and participate in other events that the government is organizing and leading. Recently, there was a horticulture expo organized by the Ministry of Agriculture in Ethiopia, and we were given a significant amount of time to present our model, the technology, and there was a lot of interest. We have over 200 farmers waiting in the waiting list. We are creating enough interest. Now it's just a matter of really addressing and reaching these farmers. So there's a lot going on, a lot of media coverage. We had recently a media that covered our work, where almost 3 million people viewed that program. It was in local language. Apparently, we shared it anyways with the team, but it was in Amharic, and farmers spoke about their experience, how significantly their income has increased, how significantly their lives have been transformed as a result of the increased income, the benefits of using various agriculture technologies, and we're getting.
Danielle, can I add?
Yes, please jump in.
Thank you. I want to say 2 things. One, right now we don't have yet 700. We will get there, I hope. We have 200 and we're on the way. But I think the most important thing is we have a very compelling story. And I would like us to, and Fegek and the team, and you saw the wonderful work that Caleb does in marketing. We get a lot of press in Ethiopia. We also had a beautiful CNN and also the chapter of visionaries in PBS. But I wanted to be like all our programs, to a lot of young adults from America, now when the sky is open, to come visit our programs, to perhaps be able to be inspired. And I think this is the meaning of strengthening also the Jewish communities and getting the work is done. It's a very compelling story, helping the most vulnerable while using Israeli technology, strengthening the Jewish communities. And this is my dream that will be in any of our work. Once will be in Ghana, once will be the amazing work of the health team, and of course, Tov, and imagine more. Can you imagine women, missions of women coming to visit other women in the countries we work at, strengthening each other? I think this is something I would really want us to see, and I would really want to bring those successes to other countries as well, to see Tov in other countries that we work in. So this is something that we would aspire for, and it's an example how sustainability, it's not only sustaining the program in a certain country, but expanding it to other places. And it's a wonderful opportunity also to thank your family, Danielle, that were one of the visionaries of Tov, your family, the Flug Capellino, and together with Seth Marin, who helped us, and other donors who helped us bring it to this dream to reality. So thank you.
I want to echo what Avital just said. I also want to say on behalf of the farmers, they are very much grateful, so happy, and they want to extend the thank you to all of you that supported us. So I'm speaking on behalf of the farmers and thanking you all.
Thank you, Fagekta. Okay, so I thank you so much for sharing really interesting and uplifting insights on Tove, and thank you for your dedication and your work. And I don't know, Avital, did you want to address, I see Leora addressed Jane's question in the chat. I don't know if you wanted to say a few words about that before we wrap up the meeting.
I will say it very, very quickly. Choosing the hospital in Koshal, like everything we do, we create planning. We use our partners on the ground. In India, we used the Jewish community. We used a lot of stakeholders that we know, importers, companies, to help us choose the right hospital that not only serve the poorest communities, but also were willing to commit to a process of training the doctors while in the midst of the pandemic. And we're very grateful for choosing Koshal, because they really collaborated and not only installed our systems, but also now are going to use them for other challenges in the future. We have a waiting list of other hospitals that want to us to help them install the same systems. And using the model of Koshal, we hope to see it in many other hospitals as well. So this is an example. And as I said, Ghana will not start before a very deep planning process that we are now holding. This is what we do in every project. We use survey, we use research, we measure. And I want to thank our team that last week visited Ethiopia and installed the first CRM system that can work in places where there is no accessibility to internet. We really challenged our IT team, and they've managed to help us do it, and we'll be able to give you a lot of stats, accurate stats measuring our successes and our challenges in the coming years.
I would just like to take a moment to thank everyone who participated today. As you saw, the JDC is committed to creating long-term impact by creating creative partnerships with government, civil society, private sector, diverse communities, and the state of Israel. We hope that there will be a drive for a collective and efficient response to emergencies in communities worldwide. Again, please contact us at any time, and share any comments or suggestions, how we can improve and always get better at what we're doing. Thank you very much. Enjoy your summer.